not only bringing something familiar to the kids, which is music, but also potentially introducing them to something different. So in music therapy sessions, they get to explore instruments and get to try different things in order to help them with their health goals. If a child is isolated or it's a new diagnosis and they need help with coping or expressing some emotions, or they've experienced a traumatic brain injury and the neurosurgical team or neurology team recognizes that they need a little bit more help with their rehabilitation goals, then they might refer me to that patient. So it's wonderful because the team recognizes the little gap that music therapy was able to fill in the overall health care that Children's provides. Initially, I was referred to Charlotte just to help her cope with being in hospital. She was quite young. I would see her in the PMDU unit after all her pokes and everything like that, just to kind of ease her time, whether it was because she couldn't eat all day because she had a procedure. And then from us growing that strong therapeutic relationship, Charlotte began to rely on me for a bit more. So at first it was just to help her cope with that time, long days in hospital, to supporting her during her most traumatic times in hospital, so during her pokes and blood work, which she really, really was scared of and still is scared of. So she relies on me now as that familiar face, and she knows the activities and the interventions that we're going to do together, and it provides her an element of predictability, of comfort, knowing that I'll be here to support her during those times.
Charlotte's medical team took care of her physical health, but I was just as worried about her emotional health going through all these treatments and being so young. So that's where Karina came in. And Karina took care of her anxieties. She took the time to learn Charlotte's specific triggers, what worked, what didn't, and she became a really, really important part of our team. In an environment where they have very little control over what happens to them, Karina lets them choose their instruments, choose their songs. Even those little decisions make such a difference to a child, like they're in control. So, and I mean, Karina's become just so important to us. We talk about her all the time, you know, because she's just so positive. She has this gentle, kind nature that just brings a calmness to all of us. My husband and I have benefited too, because, you know, once we bring Charlotte into this environment and she's stressed and anxious, as soon as Karina comes and we can see her relaxing a bit, we relax. So she's just got this kind, gentle nature. You know, she's just lovely, isn't she, Charlotte? Yeah. Charlotte calls this hospital Karina's hospital because she knows what to expect when we come here. And even though there's treatments and procedures that are out of her control, Karina is a consistent, positive experience every time.
To be able to provide patients and families with therapeutic experience that is helpful, they find beneficial, and impacts their time in hospital is really awesome.